Good evening, Vuyo. Thanks so much for joining. And of course, alcohol really the big talking point. What stood out for you amongst all the briefings today around the alcohol issue?
The government digging in its heels, and they say they know their story very well. They have received testimonies of doctors and other health workers at various hospitals who tell them one and the same thing. They have done studies, they have received reports from hospitals themselves about what happened when alcohol sales were banned and what has happened since. They have looked at what other countries have been doing, but they have also looked at our alcohol consumption in comparison to other countries. Apparently, we are binge drinkers. So all those things put together have made them take the decisions that they have taken. The Minister of Cooperative Governance, Dr. Nkosazana Dlamini-Zuma, making the point very emphatically in the morning, the things we do when we have had a few, and how that then has gone on to clog our public health system in particular. Subsequently, in others, in the second briefing, the Minister of Health, Dr. Mkhize, saying pretty much the same. Take a listen to what Dr. Mkhize just said a short while ago.
Our health workers have indicated the pressure that is caused by the admission of patients with trauma. The problem with those patients is that basically breaks the routine in the hospital management of patients. If somebody comes and is bleeding, you have to drop the person who's sick and go and deal with the one who's bleeding because it's an emergency. There are a number of instances where, in fact, you have to even stop theater and rush in someone who is having a trauma because of the nature of the bleeding, just to be able to save lives. In some instances, when you deal with, for example, someone who's got a stabbed heart, literally everything freezes and everybody will run into theater even before they are fully scrubbed, and that's the nature of the disruption that comes with the level of emergency that is created by the trauma. So these particular individuals will move from theater to ICU and therefore demand attention from a large number of nurses and equipment. Now, we need those right now to deal with people who are coming with Covid-19. And therefore, to be able to create space for those individuals, we need to then make sure that we can limit the numbers of people who are coming in because of the trauma.
Yeah, so the real big argument there is that we need the beds. But of course, we cannot ignore the fact that it's shutting down the industry yet again. And everyone, from the big producers to the small tavern owners who've been able to sell off-site goods, are now going to be locked down again. And you asking a really important question, comparing it to taxis, where they can load 100% capacity. Their industry has pretty much been allowed to carry on, despite concerns that there's no social distancing in those taxis and a lot of trust being placed on the taxi operators to ensure their customers are wearing masks.
Something a lot of people have said is an inconsistency. How do you say, on the one hand, that studies have shown the world over that social distancing or lack, if you don't observe social distancing, you don't wash your hands or sanitize, and then you stand a good chance of being infected. So how then do you, on the back of that argument, allow taxis to operate at 100% capacity? The minister, both ministers, the Minister Dr. Mkhize in the briefing we've just had, and the Minister of Cooperative Governance, Dr. Nkosazana Dlamini-Zuma, earlier, really at pains to explain this one. Minister Nkosazana Dlamini-Zuma tried to, kick the can down the road, saying, well, you'll have to ask the Minister of Transport. The Minister of Health tried to do that as well, but of course, with so many questions questions being asked had to provide some answers. They insist that they have looked at some studies. China was mentioned, and they say they have looked at those and they reckon that the measures they are putting in place will go some way in ensuring that there is prevention. Saying, but also what South Africans have to remember is that about 16 million of us use taxis every day. Now, if you've taken a decision to reopen the economy, while of course you have to take into account the need to save lives, sometimes you may not get it both ways, so mistakes will be done, or there may well be shortcomings in some of the proposals that are being put on the table. But hey, it is what it is. Listen to what Dr. Mkhize had to say when I asked him that question.
But what we also found was important was the importance of the ventilation in reducing the spread of the infection, that if we were able to allow the movement of the droplets through allowing a draft in a confined environment, this actually assists greatly. They've done a number of experiments showing how opening windows and allowing a movement of air actually has been helpful. So a lot of issues therefore had to be taken into account in this case, and part of what had to be looked at was what would be necessary to sustain the movement of the taxis under all the factors that have been considered by the Department of Transport, just specifically as objective evidence done based on studies done by the Department of Transport.
And Vuyo, we have to talk about those in distress, people who really have so very little to start with and are now further hampered by an inability to make a living. Just tell us a little bit more about what the Social Development Minister had to say about people who qualify for the 350 temporary relief grant and where they're at in terms of supporting people.
Indeed. Sal, lots of questions were directed at the Social Development Minister following a briefing that she gave about what her department is doing. Not a lot to report on, it must be said. And when it came to these questions around which there were several inquiries from journalists, as to what exactly is happening with that 350 grant that unemployed South Africans are supposed to get, many of them saying they have not gotten it, they are not getting answers from the government, social development, and notwithstanding what the minister said, that SASSA was actually a good organization with proper systems, we still didn't get any answers. In fact, she couldn't answer the question of the 350 rands. She deferred to the CEO of SASSA, who could, all she could say, we're talking here about Dotsi Memela, was this.
Anybody who has not received any response, the important thing is to either go to our website, which is https://srd.sasa.gov.za, and check your status. The other way is to go to the WhatsApp line, and once you've typed the number 082 046 8553, it will give you two lines. On those different lines, it will give you either application or check your status. You will then check your status and you'll be able to see as to where your application is, whether it's pending, it's approved, or it's been declined.
And that's where we'll leave it. Vuyo, thank you very much for wrapping a day of briefings, explanations on the new restrictions and what they mean.